Welcome to our panel discussion today on opioid use disorder, the holidays, and COVID-19. I am Mike Durkis, President and CEO of Braeburn. Braeburn is a company dedicated to delivering solutions for people living with the serious, often fatal consequences of opioid use disorder. At Braeburn, we have one mission, and that is to fight the opioid crisis. The work we are doing can make a difference in the lives of patients who often shoulder the burden of treatment themselves, and we aim to reduce the stigma by raising awareness that opioid use disorder is a chronic brain disease, not a moral failing. That is best managed by evidence-based treatments. As we approach the end of the year and the holiday season, it's important to recognize that although the holidays are a time of celebration for many of us, they can also be a time of stress and loneliness for others, including people with OUD, people in recovery, and their loved ones. This is especially true in 2020 because of COVID-19. Already this year, some states have seen overdoses increase by 25 to 50% compared to the same time period in 2019. COVID-19 is not only further exacerbating the crisis due to the isolation and uncertainty experienced by many people in the US, it is also expected to affect how people will celebrate the coming holidays. But there is hope that there are tools and resources available to patients and families. And that's why we're very pleased to provide the opportunity today for our panelists to discuss how the holidays can be a difficult time for people with OUD and their loved ones in any year, but especially this year. And we hope the discussion today will provide not only insight into the challenges of the holiday season this year, but more importantly, provide some tools and resources to help people manage. I'd like to thank our panelists for joining us today and welcoming our moderator, Greg McNeil. Greg is founder and president of Cover2 Resources. He lost his son, Sam, to an overdose in October 2015. Since then, Greg has worked passionately to educate at-risk populations about alternatives to prescription opioids. Welcome, Greg, and thank you for moderating today.
Well, thank you so much for having me, Mike. And it's a pleasure to be here with our distinguished panelists, and we'll get right to it. This year, the U.S. drug overdose deaths are on track to reach an all-time high. Experts blame the pandemic, which has left people isolated. It's disrupted treatment programs, and it's contributed to an ever more dangerous illicit drug supply. In Connecticut, for example, overdoses are up 19%. In Colorado, that number is 28%. In Kentucky, overdoses are up over 30%. Today, we'll hear perspectives from those on the front lines as treatment providers, family members, and those in recovery, to learn about the additional hurdles of recovery during COVID-19, what's working, and the resources to get you through the holidays. We begin with the treatment provider's perspective. Our first panelist is Dr. Stephen Lloyd, who currently serves as the Chief Medical Officer of Cedar Recovery, an addiction treatment company headquartered in Mount Juliet, Tennessee, that services patients across Middle Tennessee. On top of his work for Cedar, he's currently a member of the Tennessee Board of Medical Examiners, as well as serving as a federal expert witness. He's a nationally recognized thought leader and clinician. Dr. Lloyd has decades of experience in internal medicine, mental health, and substance abuse services. But most notably, Stephen has been in recovery since 2004. So, Dr. Lloyd, welcome.
Thanks, Greg. It's good to be here, and I love the recovery piece. I'm grateful for that, particularly this time of year. So thank you for mentioning that.
So let's begin with your first question. How has COVID-19 impacted treatment?
Greg, it's, you and I have talked about this a little bit before, but it's further marginalized an already at-risk population. I think COVID-19 has just really brought to the forefront, which things that those of us who've been doing this for a little while already knew, and particularly telehealth. Telehealth has been a godsend in our ability to reach patients, but it's also given me great insight into where my patients are, rather than seeing them in my office for 15 or 20 minutes and the face that they put on I'm literally in their living rooms, and unfortunately in their cars, in their hotel rooms, and on street corners as they use their phone. And so what I have seen over the past 6 months are folks that are further marginalized. A lot of them were working in service industry jobs that have been extremely restricted or even eliminated. They miss a couple of months mortgage or rent, and now they are living in hotel rooms and on the street. And these are full families. These are also families that are trying to deal with kids that are supposedly remote learning, and a lot of times that remote learning is happening in the back seat of cars or on other beds in hotel rooms, and I see that every day. And I've noticed a tremendous uptick in our non-fatal overdoses. We don't have data on the fatal overdose numbers yet, but our non-fatal overdoses are up about a quarter in Middle and East Tennessee, where I work, as well as Kentucky and Florida, which are also have some coverage in those areas as well. So, Greg, what I've seen is exactly that, a further marginalization of an already at-risk population. And now I actually even have a little more insight, thanks to telehealth, into what that actually looks like.
Thank you, Dr. Lloyd. Next, we'll hear from Danielle Torino, who's the president and CEO of Young People in Recovery. Danielle, welcome.
Hi, thank you so much.
Young People in Recovery is a national nonprofit organization whose mission is to provide life skills and peer supports to people in recovery from substance use disorders and help them reach their full potential. They advocate to make communities recovery ready. Last year, they served over 40,000 people at thousands of community events and trainings. Shared life's experience has turned Danielle into a fierce advocate for those in recovery. Danielle has been in recovery since the age of 19. Once again, welcome.
Thank you so much. Thanks for having me.
So let's begin with, why has COVID-19 made those struggling from substance use disorder so much more vulnerable to overdose, Danielle?
Absolutely. Well, social isolation, not good for us as a community, right? At Young People in Recovery, I'll say we specialize in providing pro-social activities, all recovery meetings that support the many pathways to recovery, as well as the opportunity for you to advocate and build community where you live, to bring those recovery ready resources. And most of all of that work is done in person. The pro-social aspect, especially for the young people that we deal with, is pivotal, a cornerstone of healthy recovery as an individual, as a community, as a family. We support a lot of families and allies as well. It's a family disease and we heal together. And a lot of that is predicated on our access to one another, the ability to share lived experience, the ability, even on a social level, to access psychotherapeutic services. And when everyone had to shut everything down and go home, it became much more difficult. Now, many recovery communities across the country, including our own at Young People in Recovery, mobilized quickly, and we got Zoom meetings and meetings up online and other maybe not so private and confidential platforms, but we got them up in order to provide our services. However, there's still that missing aspect of one-on-one personal interaction. And then also, I'm going to piggyback off of the health IT element of it. I ran the Substance Abuse and Mental Health Services Administration's Health Information Technology team for a number of years. And we ran a large portfolio where we were bringing health information technology into the behavioral health field. And per usual, we were the redheaded stepchild. I think I'm allowed to say that I'm a redhead. And of the health field generally. We had providers who were reluctant to adopt the idea of providing therapeutic care over a computer because it's difficult to do without the right training. We had administrators push back on this idea of a person receiving distant care. And so, like many things from a policy and a legislative perspective, we were left behind in the health IT revolution. So here we find ourselves, unfortunately, amidst the global pandemic, and we weren't ready to roll out the services and the therapeutic care necessary to be provided to people on the ground from the Peer Recovery Support Services Administration perspective. And that's my answer.
Well, I want to follow up on that in just a little bit. We'll come back to some of those points of how you see these a bunch of very young people in the beginnings of their lives and how different their struggle has been today versus just 7 months ago, 8 months ago. So next, I want to move on to our final panelist, Dr. Fred Munch, the president of the Partnership to End Addiction. Dr. Munch is a clinical psychologist with extensive knowledge and understanding of substance use disorders, as well as a leader in leveraging digital platforms to help ensure that families who are dealing with substance use disorders have better outcomes. Now, Fred is also passionate about helping families support loved ones in recovery because, like our other panelists today, Fred is in long-term recovery from opioid use disorder himself. So, Doctor, welcome.
Thank you so much for having me. It's a pleasure to be here.
All right. The first question I have for you is, how has the role of the family of those in recovery changed during COVID-19?
Like any disruption, and this has been an unprecedented disruption, we see shifts in how we offer care. And we see a lot of things that have been under the surface, sort of as Danielle had said, with information and technology and digital technology, and as Stephen was saying as well, start to rise to the forefront out of necessity. Like in World War II, the group therapy, which wasn't done before, really then became a standard of care. And I think there's a few things that are happening. Families now have to be those concerned others that are providing some sort of care. Families are seeking out information to be trained because outpatient treatment centers are often closed. Residential treatment centers are full. They're worried because of their loved ones relapsing. 39 or 40%, there was a recent study of young people 24 to 29 are moving in or plan to move in with family members. Family members are now seeing the ravages of substance misuse for those who've moved out, and they thought they were done. And so the family is a dynamic system. And when there's a shift in some dynamic, what happens is the family has to adjust, and either they can adjust in a negative way or a positive way. And what we're seeing is families to start to reach out. They're starting to try to find out, what can I do as a first responder? What can I do to prevent overdose in my loved one? What can I do to actively help treat my loved one? What are the resources for families that I can do? How do I communicate with my child who's in early recovery? How do I communicate with my child, my partner who's just relapsed? What do I do when there's no care? So we're seeing this increased engagement from family members, and we're seeing also that there is this desire to learn about how their own behavior is impacting their loved one and how they can self-care when they're dealing with a loved one's substance use or they're trying to promote recovery.
So let's build on that. You mentioned a lot of things in terms of the shifting role of the family here in supporting their loved ones. Can you talk to and speak to some of the resources that are now available that perhaps weren't before?
Sure. As everyone was saying, there's been a shift. We've been a national helpline for many, many years, where we've had phone support, text messaging support, but we've done a few things to open up the medium. So we now have Facebook support, we have chat support, because we're seeing that people are engaging in digital platforms more. So we want to be out in the world so people see that there are resources, because they don't know where to turn. If they type in treatment, and online support for family members is going to be the last thing that's going to show up. So making sure we're out there to get those family members engaged. And then we've expanded our resources to not only include our helpline, but to ensure that there's a continuous engagement over time. It used to be a little bit more of a one and done, but we always focused on making sure people can come back to us. And as Stephen was saying, you're really seeing the need for continuity of care over time and the need for ongoing support. So we now proactively reach out to people who've contacted us to make sure that if they need assistance, more assistance, whether that's finding treatment in the time of COVID, digital resources, self-help resources, we're there. And then the last thing that we've really focused on doing, because we already had the infrastructure, is to expand our online groups, as Danielle and Young People in Recovery are doing and others are doing, which is because of the lack of social connections, people are searching. And now location is not a barrier. You can be in the middle of, the Rockies and get care, and you can go to a meeting in New York City. So what we're doing is we're really reinforcing to family members that they can support themselves through these online groups, but they can also support their loved ones, and really to utilize all of the online resources that exist right now and engage in that discussion with their loved ones who are struggling, and do it with them. Go to meetings with them. It was really hard to do that before. Sit in a meeting, see what it's like, engage in the recovery in a different way. And so, and there's also multiple other resources from great organizations around the country. This shift is unprecedented, and I think it's additive of just very briefly, everything we're doing right now, all of the horror that we're witnessing right now, I do see that there are positives that will come out of this in terms of digital mediums being a valid form of care, and it will supplement in-person care in a different way for that ongoing low burden touch so people can engage.
Stephen, can you speak to the additional resources that have emerged above and beyond telehealth within the treatment field?
Well, I wish there were more than what I actually have access to, Greg, and appreciate Danielle and Dr. Minch's, agree with what they said, just 100%. But there's a lot of online resources, as Dr. Minch was just talking about, and those are emerging. I mean, just even a year ago, if you would have told me about online groups and some of the 12-step and other support groups of being available like this, I mean, I don't think I could see it down the road, but I not to the level we have now. So I think it's greatly sped things up. I think for a large part of the population, because I'm working in a different area, and I have to admit, Fred, I got a little bit jealous there of families that are involved in their recovery, because I'm seeing folks that are not at that point. I'm seeing folks that have lost their families, that have had communication cut off with their families. And I love the ability to see people by telehealth. I love the ability of engaging them in group. But Danielle touched on this. The opposite of addiction is not recovery. The opposite of addiction is community and relationship. And that's the part, Greg, that I'm still trying to figure out, is how to integrate that piece with the technology going forward as hopefully the pandemic gets under more control. There has been an increase in resources as far as peer support. We've been able to leverage that and get this peer support to our folks easier than we could when we were in person. But there's still a great dearth out there of things that we need. So, one of the things I have a really hard time impressing upon people is our overall health is about a 5% slither of being able to see, doctors and nurses and other healthcare providers. 95% are these so-called social determinants of health. And I don't think that has emerged quickly enough to help us hook people up with affordable housing in situations where they've been displaced. Other healthcare outside of addiction, I think, is lacking, because we have folks that have greatly restricted the number of people that they see during the pandemic, or they won't see anyone new. And I say that even more from the psychiatric side of the coin as well, because when I've needed a psychiatrist, it's been very, very difficult to do. So there's been a lot of advances. There's been a lot of things that have been made more available. But I think that's outweighed by the things that are really having restrictions on and having a hard time with, just because of folks being reluctant to see new people.
So now let's pivot to the holiday season. This is going to be one like none other. What advice would each of you have to help those struggling with substance use disorder in navigating these holidays? Danielle?
Ooh, it is going to be a difficult year, right? We have families that are separated, and on top of everything else, not to stress on the negative, but the dangers for a person specifically early in recovery, not just the isolation, but the stress and anxiety of getting sick or making the family member sick, having been sick, losing one's job. We work with young people. My first job in recovery as a young person was I was a waitress, right? And so we're in the arts, we are in retail, we are in the restaurant and entertainment business. All of those things have been shut down for a long time. Financial insecurity, job insecurity. How am I going to put family food on the table on Thanksgiving and on Christmas and on Hanukkah and on the upcoming holidays, where that's a part of our cultural sharing of the season of merriment, right? And then, of course, we have increasingly dangerous toxicity of drugs hitting the streets more and more as the months go by, which is also contributing to our increase in overdose, with the same level of distribution of overdose reversal drugs at the same level of access as we had pre-pandemic. And so this holiday season is going to look like all of that, not just for people in recovery, but for all of us. Right? For people not in recovery or who haven't experienced a substance use disorder, we're talking about increases in anxiety, depression, and the misuse of substances. Increase in alcohol use is something that we've seen go up in all of our communities as well. And so let's talk about those online resources. I can talk about it from the perspective of young people in recovery. We've been able to get every single offering we would have had in person online, which means if you go to our website, youngpeopleinrecovery.org, you can see a calendar of all recovery meetings and events with 4 to 5 things to do per day, with an uptick and some holiday flavored things in our pro-social events category. So you can come and spend your holidays with us. And you can pick a group anywhere in the country, regardless of where you live. Now, also, this is the privilege of having access to good internet connection. We don't talk about enough, I think, especially during this pandemic, that not everybody has access to a smartphone or internet access that allows these pro-social events to be easy to attend. And those are the people. So we have phone lines like what we've got going on at Partnership, right, Fred? Thank God. And so there's a whole lot of call-in options as well that we can provide to people during this season if you don't have steady internet connection. But it's also about making sure that we get those resources out to our community. And how can we do that if we can't meet or coagulate, so to speak, in groups of more than 4 or 5 people. And so for us, young people in recovery, it looks like pumping out as much stuff as possible on social media. It looks like flyer campaigns in the streets and posting things where we can, whether that is libraries or grocery stores, places where people are visiting on gas stations, places that people are still visiting on a regular basis, and sort of going back to that old school grassroots guerrilla campaigning style in order to ensure that our information is getting out there. And not just sharing our information, but information of our partners, because we're not the only gig in town. And so ensuring that those phone numbers are making it out there too for all the warm and hotlines. That's what our season's going to look like. And ensuring that everybody, that, it's not one size fits all. Recovery is not one size fits all. And so the ability, especially for us big organizations during these times, to say, what do you have? What can I give to my people that I'm unable to offer? Because it's just not what we do at YPR. We do meetings, we do life skills curriculum, we do all recovery meetings, we do pro-social events, but there's so much more than that we need to connect our communities to.
So, and the YPR meetings are open to all.
Open to all. We do not have a definition of young. So all recovery meetings are open to all families and allies, and we have a decent amount of family members and allies that attend our meetings as well.
Fred, additional resources that you might point out for families right now. You mentioned in our intro there, you mentioned quite a number of things that families come to you for. They, of course, become the first responders, more important than ever right now. They look to you to train them in some respects. So what resources could you point out that would be invaluable for them for the holidays here?
One is to go to our website at drugfree.org, and we have a number of resources for individuals who have loved one in recovery for the holidays, how to manage it, what to do. how to start a conversation, how you as an individual family member can act and communicate. And we also will focus on someone who's actively using. Let's not just forget those who are in early recovery, and we have to support those individuals by, allowing them to have Zoom meetings, go to meetings, self-care, focus on their recovery, join those meetings with them, perhaps bring a friend in recovery on a Zoom meeting. If you can have something outdoors, bring someone in recovery with them, but go to the website and start to read. And one of the things we're seeing is because of the relapse rates, there's a lot of tension in families. And what we see as the opportunity in the holiday is to reform a connection if there is some disconnect. We don't have to disengage the way we have. There are times when we can re-engage and have a family member where we're positively reinforcing behaviors that are moving towards recovery. If someone wants to engage with the family during the holiday and they've normally been disengaged, that's great. How can we learn how to communicate with that loved one? How can we have a day where we express our love and gratitude as a family in a different way? How can we just take a little bit of a break? And a lot of the resources we focus on is really on communication, because what that does is once communication breaks down in a family, especially on the holiday, all hell breaks loose. And so making sure that family members are focused on self-care, making sure that family members understand where their loved ones are when they're struggling, that shame and self-hatred of ruining a family vacation, a family holiday, and empathizing, as well as bringing the person into and making this an opportunity for intervention. Because every moment we have with a loved one struggling is an opportunity for intervention. So we try to train family members to do that. And in addition, I do want to say there are meetings. We have online support groups, but as Danielle said, there are meetings for family members, smart recovery meetings, unity recovery. The meetings for family members, I think, has been the biggest shift in the self-help movement since the beginning of COVID. And I encourage people to explore them. We have a list of online resources for family members on our website.
Some people struggle with Zoom and they struggle with telemedicine. Are there any strategies that you've found, Stephen, to help them overcome that and bring them back to the table? Some people just, they can't adapt.
It's so funny, Greg. In January, I couldn't tell you with a straight face that I knew what Zoom was. I mean, if I'm being completely transparent, but was able to mobilize very quickly. So that was some of the stuff I was writing down as I was listening to Fred and Danielle talk. I'm in rural Tennessee. I mean, I know Nashville is a metro area, but I service a lot of folks in rural Tennessee. And the clinic I'm sitting at right now is in East Tennessee at the foothills of the Smoky Mountains. So this is rural Tennessee. And as I hear about online meetings and all these resources are out there, it's great. And I love it. And I participate in them myself. The problem is lack of broadband internet. And so I've become very good at knowing where free internet is. And I can tell you that McDonald's and Dollar General, there's a plug for both of them, I am a big fan of. I actually have an app that'll tell me where they are, and I can actually GPS my patients to them because I want to be able to see them and not just talk on the phone like we're doing here. It's not in person, but it's better than the phone. And so, those are some of the things we've learned is how to access internet whenever you are in some of these rural areas, because a lot of places that I deal with, they don't even have internet, they don't even have cell phone service, right? You have to drive a little ways to get cell phone service. And so, learning where those are and then actually being able to guide patients to them has been something that we've really focused on. We've taught our patients how to use these internet formats like Zoom, like some of the other online platforms, and we had to be very nimble at doing that. Thank goodness I don't work for a big company that would have required 14 levels of approvals to do that. And so we actually taught our patients how to do that, sometimes in person if we could get them to come into the office, but a lot of times online or over FaceTime. And so one of the things I want to see, Greg, very much is I want to see the regulations that have restricted the use of technology that have been relaxed during this time of COVID-19. I want to see these things permanently relaxed to give us access to these tools so that we can then figure out how to integrate the technology along with the very much needed personal face-to-face connection.
So changes in regulations have impacted a number of things during COVID, specifically as it relates to medication-assisted treatment. Would any of you like to comment on the impact of some of the changes there relating to monitoring medication, that is, and dispensing it? Danielle?
I think I'll keep my comments as broad as possible in that access to medication and all forms of substance use disorder treatment that people seek that aren't traditionally reimbursed for with equity on telehealth platforms, as well as aren't always viewed equally in the eyes of certain state laws, as well as certain reimbursement laws, which are extremely important, especially for our patients on Medicaid. That I agree with the permanent relaxation of a lot of those laws. That, you know, we've been talking about having treatment deserts and recovery deserts and access deserts in almost every community outside of major urban areas, which is are also technically in their own right treatment deserts for culturally competent care. For how many decades now? And so if we're going to, and I'm excited to see the data, because I think allegorically, those of us that have been around this for a while know what that data is going to say about what happens when we allow easier access to things like medication and MAT and all other types of substance use disorder treatment that might not be considered traditional, but deserves to be reimbursed at the same rate because of the practice-based evidence that is behind it. I think we're going to see more people being able to get and seek help where they are. We believe very deeply at Young People in Recovery at meeting people where they are at. And trying to fit the square peg inside of the golden standard round hole of substance use disorder treatment has continued to emphasize and make our drug, because it's not just an OUD epidemic, it's a substance use epidemic. We still see meth rates and alcohol rates as high or higher than ever. And so we have to talk about the entire patient population, not just the opioid use disorder population. That more access equals more people able to access, receive care that is culturally competent and meets them where we're at. And if relaxing regulations leads us to be able to A, have more data to study, and B, have the ability to bring care to places we otherwise wouldn't have been, let's relax them.
Fred, how important do you think that it is to extend some of these restrictions to take home medication for medication-assisted treatment after COVID?
I couldn't agree more with everything Danielle said. As someone who in New York City had to travel a half an hour each way to get methadone, and then had separate behavioral health appointments 6 hours after getting medication, so I wouldn't go, and I ended up not going. And this opens the door to access. It opens the door to behavioral health treatment integrated into medications for addictions treatment in a way that was never done. We have an amazing opportunity to re-engage people into care locally as well after COVID if they're getting their medication through remote-based care. So couldn't agree more. I'd also like to add that, family members can serve as an amazing resource for those who are taking medications who have traditionally not been used as that resource. Some of the same biases that exist within individuals struggling in the recovery community around medications, family members also exhibit, and sometimes more. And so what we are doing at the partnership is really helping people explore their beliefs around medications. We're launching in a month a new program for family members who have a loved one who are taking medications for addictions treatment, to support them, to understand when they might have early warning signs of relapse, to understand when the medication is working, not working. So we see this as an opportunity to engage the support system around the individual in a different way rather than in a program that might be separate from other recovery services.
As a follow-up, does harm reduction play into that part of the education?
Without question. So we think about, and so when we think about family members, very often family members are trained to say it's all or nothing, or family members are trained to disengage. And we try to focus on supporting an individual, how they're feeling, but retrain them to think that these are antiquated ways about thinking about recovery. So, as we work with different family members, we focus on understanding, meeting loved ones where they are. And very often what you see is a shift, particularly with the fentanyl on the streets, is loved ones want to keep their family members safe. And once we tell them it's okay if someone's taking a medication, it's okay if someone's not entirely abstinent right now, as long as they're safe, they have this amazing sense of relief. Like, oh, okay, great. They don't have to do it this way. And so, it's a big part of our conversation.
During this time of struggles, where our entire country has, and the world for that matter, has grappled with things that we've never seen in our lifetimes, there's had to have been bright spots for each of you. Each of you work with people tirelessly. I know you all personally, and I know the passion that you bring to this. I'd like to talk a little bit about some of the success stories that you've had and the things that you've witnessed. And I'll leave that wide open for each of you. Danielle?
Sure. Oh man, there are so many of them, honestly, and it starts with, well, I'll tell my own story, right? Because I think that's usually the best way to demonstrate why we all wake up and do the things we do every day in this field, even though it's hard and can sometimes be extremely exhausting. And I'm sure my fellow executive directors and CEOs can relate to a level of burnout that we should have our own support group, honestly, because it's hard to get up and do this work every day. And with that said, because we moved all of our meetings online, I had actually never had a chance. I became part of the YPR family back in January. And so the shutdown happens pretty soon after I take over this job. And because of my physical location, I actually didn't have any access to young people in recovery, all recovery meetings, because at the time I was living in Washington, DC, and we didn't have any there. And so upon the shutdown happening, I see all of our meetings start to pop up, and I see that one of the topics of one of the meetings in our Rockport, Texas chapter, which is nowhere near where I live, is going to do their topic on former Miss America, Tara Connor, and they were going to watch her video, her TED Talk, and they were going to talk about it, and that was the topic of the meeting. And Tara Connor happens to be a close personal friend of mine, so I was like, I called her up. I said, hey, Tara, we're doing everything virtual. I think it'd be super cool if you just showed up on this call and we don't tell anybody because they're discussing your TED Talk today. Also, I've never been to a young people in recovery, all recovery meeting before. So we could go together and it'll be a chance for us to see each other as well and connect with actually everybody that showed up to the meeting that day were all women. And Tara and I log in, and there we are on this all recovery meeting. Everybody like freaks out because Tara Connor's there to join us to talk about her own TED Talk. And so there's that level of access and the ability to spend time with our own membership and our own community, because we're spread across the country. We're in 60 communities across 16 states, and I can't spend a lot of in-person time with every single one of our chapter members and members. So personally, this has given me the opportunity to see what happens for young people in recovery on the ground, which is sort of the fire under my ass, excuse my French, every morning that keeps me going and keeps all of us going, is when we see that everything that we do all day, whether it's reviewing spreadsheets or the stuff that comes with life that it takes to keep these businesses in business, that we're doing it for a reason, that there are real human lives and real human families on the other end of everything that we do. And the ability for me to see that in a deeper way has been truly remarkable.
A profound moment for you. Yeah. Fred, same question.
I agree. If I think, even to bring it back to some of the trends we're seeing, I know this is about recovery, but we are also seeing something on the early use prevention, early use, where some of the social reinforcers aren't necessarily there. And we're seeing some drops in early initiation, and parents reporting that the young people are not drinking as much, they're not smoking as much, even though we are definitely seeing those who were sort of past a certain threshold are getting worse. But for those below that threshold, there may be an opportunity to delay use, perhaps, and that's a positive sign. But with regard to those who are struggling, those in recovery, I think we're seeing the family empowered in a way. And it's tough because it doesn't start that way, and it starts with a lot of chaos. And but when you put someone in one of these situations where they have to react, and very often people will rise to the occasion, and even if it's just about empathy for each other in the family, that a loved one. So there was a story of a loved one, this was early on, who a young person who moved back in with their family, and the parents had to create a room for him in the garage because he was going out to use, and he was putting the family at risk. And this was creating chaos. And the end result was actually that the child saw what he was doing to his family in a way that actually affected them in a different way, right? Because when you're using, you're like, it's me, just everybody get away. I don't worry about me. I'm sorry, I'm making you feel this. But he was seeing that this was actually affecting and could affect people, and moved towards recovery and went to treatment. So this sense of shared responsibility, this sense that it's not someone else's problem, or go fix yourself, or go do this, I think that is one of the biggest shifts that I hope will be maintained after this horrible period is over.
Wow. Stephen?
Yeah, thanks, Greg. I was just reflecting on Danielle and Fred talking, and I can tell you this, that no matter how far I go or what I wind up doing, I have to see patients. And I love seeing patients. I've got friends that says, oh, I've got clinic today. And I think, what do you think we do? Right? We see patients. And so I get fed by seeing patients. And so what you've essentially asked us for here in recovery terms is a gratitude list. And I love gratitude lists. So I got two quick ones. At the start of the pandemic, I had a girl that I was seeing as a patient, and her significant other got out of prison after being in there for 8 years of nonviolent drug offenses. And he overdosed twice in the first week after getting out of prison. And we all know what the risks of that are. And he took a gamble, and he saw me meeting with her at the first of the pandemic on Zoom, and piped in and asked for help because he didn't think it was possible. He didn't have money. He didn't have this. Well, we had access to a grant through the Tennessee Department of Mental Health and Substance Abuse Services, and we were able to help him. And that was in early March. It's now late November. He's still my patient. I saw him yesterday. And a few weeks ago, he took me outside with his phone as we were doing his Zoom call, and he showed me his new truck that he just bought because he's been employed for the last 6 months. That jacks me up. And it jacks me up every single time I get to do it. I had another young lady right at the start of the pandemic that was really, really worried, taking care of her through her pregnancy, secondary to her opioid use disorder. She was pregnant with twins and worried to death about coming into the office. And like it or not, I pretty much joined her in the delivery room as we did her call as she held her babies. And so she didn't have to come into the office and expose herself or worry about exposing her babies. And Fred talked about that earlier, about getting someone else sick. And, I think we think about family members. We don't think about mother, child, and infant. And so those were just wonderful things to be able to do that would not have been able to do without the relaxed restrictions around telehealth. And I'll tell you this, access to treatment through emergency departments in jails and prisons can be a game changer if we utilize this technology in the right way, coupling it with the things that we know that work long-term with behavioral health change. And I can tell you that before the pandemic, the brightest spot for me, I would have a clinic, and if I saw 2 out of 3 patients, it was a really good day. And now I have clinics multiple days in a row where I have 80, 90, 100% show rates. And the secret to recovery is to keep coming back. No matter what, keep coming back. Over time, if we can keep people engaged enough over a long enough period of time, we will get more and more into long-term recovery. And so, Greg, I'm very grateful. I love this time of year, Thanksgiving, but being able to see these things, I get to witness firsthand, up front, miracles every day. And I, can go on and on, but those are 2 good ones.
Last question for you all. What would you like people to take away from this panel? Danielle?
So I wouldn't be first.
Okay, Fred, I'm going to skip on to you. That's fine.
Cool.
Regardless of the audience, is that you can be empowered to affect another person's life simply by connecting with them. And that connection, if it's proactive, is all the better. You don't have to wait for someone to relapse. You don't have to wait for someone to reach out for help. Is that as a family member, as a friend, as a loved one, whether it's your elected family, your extended family, it doesn't matter who you are, is that you have the opportunity to change someone's life through connection. And at this time, we have the opportunity to connect with someone across the country. It's become normalized to do that. And those digital breadcrumbs that we can leave on somebody's phone through a text message matter. And so I just encourage everyone who is listening, and a part of it is that we're all responsible and we all have the power to make a huge difference in someone's life with just a little bit of effort.
Digital breadcrumbs. I love that. Powerful. Stephen, same question. What do you want people to take away from this panel?
Well, I'm going to take away digital breadcrumbs. I can tell you that. Such good stuff. I heard this recently and I loved it. It said that people make sense in light of their stories. And I believe that. I believe that to the deepest part of my soul. And with that said, I want people to take that away, because when we start looking at addiction, not as a moral failure, but as an organic brain disorder, and that people make sense in light of their stories, then I think it becomes a little easier for us to meet them where they are, no matter what. The people that walk in my clinic every day, I think doctor-wise, I'm average. Hopefully I'm average, but hopefully I'm above average in bringing myself to every encounter. I truly meet people where they are. I meet people that shot heroin in my parking lot. With the same face, I meet those that have been doing well for 15 years. And I would encourage us all to love one another, meet people where they are, so that we can help them feel better, get better, and stay better. And that's it. It's not complicated, but that consistency of showing up, Greg, and being willing to step into it, even when it's messy and even when it's chaotic, I think is key, particularly early on. And then as the chaos gets smaller and smaller and you start to watch people's lives blossom, I think that others who may have had that stigmatic view of addiction start to look at it a different way. So that's what I'd like to leave you with, is to help people find the path of recovery that's right for them, not right for you. So.
Okay, and Danielle, over to you.
Sure. Those are both hard ones to follow. So I'll add on to say that there's hope. There are resources available, that if you're not spending your holidays with your family for whatever reason, come spend it with ours. That we have family and community to offer across all of these amazing organizations on this phone, and ones that are not. And most of all, that, well, yeah, just hope that we will be here for you, that there are a lot of people that care about you, and that now is the time to engage, and that we will, just like Dr. Stephen was saying, we will meet you where you are at. And then, of course, I'm going to stop there. I'm not going to ramble. Hope and family and access to resources, I think, is available. Strangely, not that I like to say that there's a silver lining in a global pandemic, because that's ironic. But now more than ever, there are access to each other and things that weren't previously there for our patients, for our people in recovery, for our families, and that we really hope you come join us.
A great message to leave us with, the message of hope. I want to thank you all for joining us on this powerful, powerful panel today. We'll please share the resources, send over to us the resources so that we can publish them with this panel. So I want to thank you, beginning with Dr. Fred Munch, President of the Partnership to End Addiction. Fred, thank you.
Thank you.
And Danielle Torino, President and CEO of Young People in Recovery, and a powerful advocate indeed. Danielle, thank you. And finally, Dr. Stephen Lloyd, the Chief Medical Officer of Cedar Recovery, and a powerful national advocate for recovery, and just a thought leader for our country and for the recovery community. So Stephen, thank you.
Thank you, Greg.
Okay. I want to wish you all a very enjoyable Thanksgiving, a wonderful Thanksgiving, happy holidays, and our paths will cross very soon, I'm certain. My name is Greg McNeil. I'm the host of Cover2 Resources podcast series. It's our PPT podcast series. It's a series about people, places, and things making a difference in the opioid epidemic. And we want to wish all of you a happy Thanksgiving and happy holidays. And once again, thank you to everybody involved in the production of this program today.